Hello, mental clarity fam. This is Dr. Mary Opara, hoping all is well with you guys. Today we will address attention deficit hyperactivity disorder, popularly known as ADHD. We're going to talk about what ADHD is. We're going to talk about the types of ADHD. We're going to talk about the DSM-5 criteria. We're going to talk about how ADHD impacts adults, why it is misjudged in adults, and treatment options. So everything we're talking about today is concerning adults. So who says adult ADHD is fake? Lies, and more lies. Adult ADHD is real. It is underdiagnosed, and it is misjudged a lot. So let's look at the meaning of ADHD. ADHD is a brain-based condition that makes it hard for someone to focus, stay organized, concentration, they get distracted easily, makes it hard for them to manage time or control their impulses. It's got nothing to do with being lazy. It's got nothing to do with being careless. It's all about how the brain processes attention and motivation, and also self-control. It's not about discipline, and it's not about intelligence either. It is about how your brain is wired. Well, you know I like metaphors, so I can't get by without trying to use one. So here's one for ADHD in adults. Imagine your brain is a computer with 50 browsers all open at the same time. Playing sounds, and every single browser needs your attention. You can't mute them all. And every time you try to close one, 3 more pop up. That is what ADHD is like. That is what ADHD actually feels like. Imagine that going on in your head. So there are 3 types of ADHD, and this is according to the DSM-5, which I've told you guys before is the manual that we use to get the criteria for different disorders. The 3 types are predominantly the inattentive one, which is trouble paying attention, organizing tasks, finishing what you start. So it's more inability to do that. And then we have the predominantly hyperactive one, which is where you're restless, very restless, impulsive, talk too much, acting without thinking, that impulse, lack of impulse control. Some people are very fidgety. And then some people have the combined type, which is the combination of both the attention and the hyperactivity symptoms. So, and in order for you to be diagnosed, according to the DSM-5 criteria, it has to have started at childhood, maybe before even the age of 12. Even if it wasn't noticed until later on. And you have to have at least 5 symptoms of inattention and or hyperactivity. And that has to continue into adulthood. So it's not you have it and then it goes away. These symptoms must cause problems in 2 or more of these areas. And the areas are work, school, home, and relationships. Yeah. The symptoms must be chronic, not just once in a while we forget something or you have stress-related distraction. Can't be that. Today, there's a lot of stress in the world. Something's always going on. It's either a plane crash, an earthquake, flooding. The world is moving too fast. It's moving at a faster pace. If you blink, you'll get left behind. And because of all that, everybody worries a lot. You get distracted easily. We lack focus in what we're doing. We forget a lot. You get that inattention at work, school, and sometimes the home life. And I tell patients a lot that we acknowledge what you're going through, but not all these cases are ADHD, because 9 out of 10 people, can't have ADHD and never had it before. So, but we understand what people are going through because of the high stress of today. What are the causes of ADHD? Let's look into that. ADHD isn't caused by lack of parenting skills or lack of parenting or lack of discipline. It's mainly neurological, and it's also genetic. So sometimes in a family, you could see it could be a father, mother, could be grandparents. Sometimes it could be multiple people in a family that have ADHD. It doesn't have to always be just one person. So that's how it's genetics. Most of the times when we diagnose people, they'll also say, yeah, my dad kind of had it. He might have not done anything about it, but he had it. Or mom. Brain differences, the areas of the brain that control the attention, planning, impulse works a little differently than other people. Another cause of it is the neurotransmitters being low in the brain, dopamine and Norepinephrin. These are the chemicals that regulate attention and motivation in the brain. So when they're low, that could cause ADHD. Another thing that could cause ADHD is environmental factors like premature births, exposure to toxins like lead, or early trauma sometimes can play a role. So what is the age of onset for ADHD? Age of onset for ADHD is usually in childhood, but for many, it isn't recognized until adult, or they didn't start getting treatment until they became adults. Because I remember back in the days, a lot of parents didn't want their kids treated. So adults might realize they've had it all along after years and years of struggling, years and years of masking the symptoms of disorganization, trouble following through with whatever they're doing, whether it's work or homes, whatever they're doing, chronic lateness, distraction with things, difficulties in their relationship, difficulties at work, and people just do the best they can to get through life. But that's what it has always been all along. So if we look at how ADHD impacts adults, well, let's look at work. Procrastination at work, you have missed deadlines, difficulty staying on task, jumping from one task to the other, forgetting a lot of things. Even at home, you forget chores, you forget to do things that you had planned to do. You feel overwhelmed. You're not meeting up with the daily responsibilities. And you do feel overwhelmed because it's hard for you to do those things. Relationships, you're being seen as unreliable, inattentive, or emotionally reactive. Because when you can't do these things or do them the way your partner expects you to do it, it brings about a lot of tension. Brings about a lot of those low emotions, frustration, mood swings, or chronic stress because you're not knowing how to handle all of that. And that brings about self-esteem issues. The adults feel that they're not good enough and have had years and years of being misunderstood, especially like in their relationships or work. People with ADHD often feel like things that everybody else found easy to do, they struggled with it. And it's just because their brains worked difficulty, not that there was anything wrong with them. So why is ADHD commonly misjudged in adults? Underdiagnosed in adults, untreated sometimes in adults. Well, because it looks different in adults. It's less of the hyperactivity, you have the kids jumping on the desks and screaming and yelling out in class and all that. For adults, it's more of internal restlessness and mental clutter. And sometimes that's blamed on stress, anxiety, depression, sometimes even laziness, even though that's not what it is. Some adults develop coping skills, try to hide, put on a mask to hide everything till life becomes more demanding and more challenging, like a new job that you really have a lot to do. Or parenting, you have a newborn now and you got to keep up. It's just so much going on. And a lot of adults don't realize that they've had this since childhood. They always just thought life is a little harder for me than most of other people. There's also the stigma, still stigma surrounding ADHD. Especially when it comes to high-functioning professionals, they don't look like they have it. Providers may suspect drug seeking, because stimulant medication are controlled substances, and it has a lot of misuse and it has a lot of abuse. Because they're controlled medications, providers always have to proceed with caution, because you don't want to overprescribe it or be questioned for overprescribing of controlled medication. Nobody wants to lose their license. So sometimes you get people out there who do not need it, but make it harder for the people who actually do need to be able to obtain these prescriptions to do better with their life. And that's sad, because that's not fair to the people who actually need it to be able to function and get their work done. So what are the treatment options? Treatment options are, good news, drum roll. I'm so silly. Good news is ADHD is treatable. Yay! Medications are often the first line of treatment and can greatly improve your control and your focus. Stimulants. We use stimulants, Vyvanse, we use Adderall, we use Concerta, we use Ritalin, Mydayis. The list goes on and on. And when you take those stimulants, they help balance your brain chemicals. Remember, we talked about the low dopamine and Norepinephrin. So it helps give your brain a boost, and that definitely helps. I use Wellbutrin a lot too, because that does help a lot of people too. It's one of those off-label uses for ADHD. And then we have the non-stimulants. We have Strattera, we have Qelbree, and Guanfacine. Those are for people who don't tolerate stimulants well or have coexisting issues like anxiety or tics, and we don't want to do stimulants, or they don't want to be bothered with, or people who have other issues like high blood pressure, uncontrollable high blood pressure, they don't want to use that. Then we have the non-medication management ways to do it, which is like Therapy-CBT therapy, which is the cognitive behavioral therapy. It helps people, when you do that therapy, it helps you learn how to manage your time, how to organize things better, and it also helps build your self-confidence back, or self-esteem. Then we have the lifestyle strategies. Consistent routines does help a lot. Use planners, use reminders, use alarms, phone alarms. Oh, I use that every day, all day to help me remember to get things done. Breaking tasks into smaller manageable steps or parts is good. Exercise is great. Sleep habits, get good sleep. When you do that, it helps boost your natural dopamine. Support groups are good. Sometimes you do meet up with people, or could meet up with people who encourage one another and share what they use as their coping tools to help manage ADHD. In closing, ADHD is a real neurodevelopmental condition. It's not a personality flaw. Adults with ADHD often have incredible creativity, believe it or not, energy, and also problem-solving skills. But they just need the right tools and understanding to thrive. With the proper diagnosis, with medication, when needed, and structure, ADHD can be managed, and very successfully too. It can be. Don't miss next Friday. I will give you some valuable tips on how to be able to obtain your ADHD medications without further challenges if it's something that is needed. So, till then, always remember, I care for you. I love you. Please subscribe, share, ring the notification bell, and I will see you back next Friday. Bye for now.
Thanks for spending time with me, Dr. Mary Opara. Don't miss next Friday for another powerful session. Until then, like, share, and subscribe to keep the conversation going. See you soon.